Step 1. Preparing the pen. Note: your healthcare provider may prescribe a dose of Gonal-f RFF Redi-ject that requires you to use 2 pens. If you need to use 2 pens, follow the same instructions for both pens. Take the Gonal-f RFF Redi-ject out of the refrigerator at least 30 minutes before you plan to inject your dose to allow it to warm to room temperature. Allowing the Gonal-f RFF Redi-ject to warm to room temperature before injecting your dose will help make your injection more comfortable. Open the carton by lifting the blue tab to open the top of the box. Look at the pen and make sure you have the correct pen strength of Gonal-f RFF Redi-ject. Along with your pen, you should see needles in the carton. Prepare a clean, flat surface like a table or countertop. Gather all the supplies you need to give a Gonal-f RFF Redi-ject injection. Wash your hands well with soap and water. Dry your hands well. Remove the pen and a new needle from the carton. Set aside the carton with extra needles. You will store the partially used pen in the carton later. Do not shake the pen. Shaking the pen may cause air bubbles to appear in the reservoir. Become familiar with the parts of your pen. The numbers you see in the dose display and the reservoir represent the number of international units, IU, of medicine. Check the expiration date on the pen label. Do not use the pen if the date has expired. Get another pen with the date that is not expired from your healthcare provider or pharmacist. Hold the pen with one hand and pull off the pen cap with your other hand. Put the pen cap aside. You will place it back on the pen later. Check the reservoir in the pen. There should be no cracks in the plastic window, and there should be liquid in the reservoir. The liquid should be clear and colorless with no particles. Get another pen if there are cracks in the reservoir, there is liquid, or the liquid is not clear and colorless. Check the dose display in the pen. If there is any number other than 0 on the dose display, set the dose display to 0. To set the dose display, turn the dose knob in a counterclockwise direction until you see 0. Step 2. Attaching the needle to the pen. Pick up the new needle. Remove the peel-off seal from the outer needle cap. Hold the outer needle cap in one hand and the pen in your other hand. Place the needle on the end of the pen where you see threads. Using some slight pressure, screw the needle onto the pen in a counterclockwise direction until you cannot turn the needle anymore. Gently remove the outer needle cap and place on the table to use later. Leave the blue inner needle shield on the needle. Step 3. Removing large air bubbles from the pen. Small air bubbles in the pen's reservoir do not need to be removed from the pen, but large air bubbles in the pen's reservoir must be removed. A large air bubble is a bubble that appears all the way across the top of the reservoir. If you do not see a large air bubble, go to Step 4 to select the correct dose of Gonal-f RFF Redi-ject. If you see a large air bubble, turn the dose knob in a clockwise direction until the dose display reads 25, meaning 25 IU. Only use 25 IU to remove air bubbles. With the needle pointing up, tap the reservoir with your finger to allow any large air bubbles to rise to the top. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. Holding the needle pointing up, slowly press the dose knob as far as it will go. Release the dose knob. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. Using one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Replace with a new capped needle as described in Step 2. Step 4. Selecting the correct dose of Gonal-f RFF Redi-ject. Check your treatment diary if you are not sure what dose to use today. If you are unsure about your dose, call your healthcare provider. Turn the dose knob in a clockwise direction until your prescribed dose of Gonal-f RFF Redi-ject shows in the dose display. Do not push or pull the dose knob while you turn it. If you pass your dose, turn the dose knob back to the correct dose. Look at the dose display on the pen in bright light, like by a sunlit window or under a lamp. If there is glare on the pen, move the pen so you can clearly see the dose display. The dose display here shows the dose of 150 IU as an example. Your prescribed dose may be different. Step 5. Selecting the injection site and injecting your dose of Gonal-f RFF Redi-ject. Your healthcare provider should show you the injection sites to use around your stomach area. Your healthcare provider may show you another area of your body to use for your injections if you cannot use your stomach. Use a different site each time you inject yourself to reduce the chance of skin problems such as redness and irritation. Select your injection site and wipe the skin with an alcohol pad as your healthcare provider showed you. Pick up the pen. Make sure the dose on the dose display matches your prescribed dose. If the dose does not match your prescribed dose, adjust to the correct dose. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. Hold the pen at a 90-degree angle and push the needle into your skin. Press down on the dose knob with your thumb and hold the dose knob as far as it will go to complete the full injection. Wait at least 5 seconds to make sure you receive your full dose. Carefully remove the needle from your skin and put the pen on the table. Hold a gauze pad firmly on your injection site for a few seconds to make sure the medicine dose does not leak out. Step 6. What to do when your injection is completed. Do not recap the needle with the blue inner needle shield. Recapping a needle can lead to a needle stick injury. Remove the needle from the pen after each injection. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. With one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the needle from the pen. Find the pen cap and push directly onto the end of the pen. The pen cap will not fit over a used needle. If there is medicine left in your pen, go to Step 9 for storage information. If there is no medicine left in your pen, go to Step 7 for disposal information. Step 7. Disposal of your used needles and pens. Put your used needles in an FDA-cleared sharps disposal container right away after use. Do not throw away loose needles and pens in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of a heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid, without sharps being able to come out, upright and stable during use, leak-resistant, and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your sharps disposal container. There may be state or local laws about how you should throw away used needles and pens. For more information about safe sharps disposal and for specific information about sharps disposal in the state that you live in, go to the FDA's website. Do not dispose of your used sharps disposal container in your household trash unless your community guidelines permit this. Do not recycle your used sharps disposal container. Step 8. Recording the Gonal-f RFF Redi-ject injection in your treatment diary. Unfold your treatment diary and fill in each column as indicated. For detailed examples of how to complete your treatment diary, please refer to Step 8 in the detailed Instructions for Use. Step 9. Storing your pen. Before you use your pen for the first time, store your pen in the refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius until the expiration date, or store your pen at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius for up to 3 months, or until the expiration date, whichever comes first. After you use your pen and there is still medicine left, store your pen in the refrigerator or at room temperature up to 28 days. Throw away any unused Gonal-f RFF Redi-ject after 28 days. Store your Gonal-f RFF Redi-ject with the pen cap on in a safe place. Store the Gonal-f RFF Redi-ject away from light. Do not freeze Gonal-f RFF Redi-ject. Keep Gonal-f RFF Redi-ject and all medicines out of the reach of children.